And we are now live.
Good, thank you. Good morning, this is Senator Dave Weeks. This is welcome to the February 23 Senate Health and Welfare Committee meeting. Senator Lyons, our chair, is out for a medical appointment, and Senator Hardy is out sick. But we still have a quorum. We intend to continue with our format and our speakers. We have 12 speakers lined up for this morning, and thank you all for joining us. I do ask that I'll give you a time constraint. I do ask that you respect that time constraint. We'll give, if we need to, we'll give you a little heads up that you're kind of getting towards your boundaries. But for the respect of the other speakers, I do request you stay within those time boundaries. So for this morning, we're going to kick off with the topic of today is S18. It's an act relating to the banning of flavored tobacco products and e-liquids. We're going to kick off this morning. We have 7 speakers. We'll take a break after that, but 7 speakers. First is Dr. Levine. Dr. Levine, we'll give you about 15 minutes, if that's satisfactory, and we'll go from there. So, Dr. Levine, if you would kick off, you can say your name for the record, and we'll go.
Good morning, everyone. Mark Levine, Commissioner of Health. May I share my slides?
Yeah, I believe you should be able to, sir.
Okay. Everybody with me?
We're with you. Yeah.
Super. Well, thank you for requesting my testimony. I've been invited to comment on the Youth Risk Behavior Survey, YRBS, and any other data we have on youth smoking and flavored nicotine, as well as any pandemic updates with regard to that topic. I'd just like to begin by saying the health department was very pleased to work with the governor and the legislature several years ago on what I term a trifecta of major policy changes, including Tobacco 21, increasing the excise tax on electronic vaping products, and placing constraints on internet sales of such products to youth. This presentation will also serve as a little bit of a post-pandemic update on the state of affairs. So I don't think anyone who's listening doubts the fact that tobacco use still plays a significant role in the health of Americans. It's the #1 preventable cause of death in Vermont, with over 1,000 such deaths per year. About 1 in 5 of all Vermont deaths among adults over 35 are attributable to smoking, and about 1/4 of cancer deaths attributed to cigarette smoking in Vermont. This is a very expensive proposition as well. The numbers you'll see are a little higher than the ones you have listed in the bill, so they may just be a little more up to date, but $404 million in annual healthcare costs, $94 million cost to Medicaid. And you can see the $326 million in cigarette smoking attributable productivity losses in Vermont. So significant burden, needless to say. This slide looks at current use of tobacco. 106,000 Vermonters. Here we define current use as within the past 30 days. If you look at the adult smoking rate for cigarettes, that is statistically higher at 16% than the US rate of 14%. The youth statistic for cigarettes is statistically the same. When we look at e-cigarettes, Vermont is actually statistically lower for both youth and adults, as the data shows on this slide. Like most problems we identify in public health, when we look at average data, it doesn't tell the full story. We need to really look in a stratified way at various groups and see that there are significant disparities in the data and inequities in what happens to Vermonters. So whether we look at current smoking prevalence or current use of e-cigarettes, we find that your insurance status matters tremendously. Your housing status matters tremendously. Your education, disability, and mental health status. And if you are Native American, you are significantly more severely impacted. Most of this data shouldn't be a huge surprise to the Health and Welfare Committee because we see this in so many of the pieces of data we look at, aside from use of tobacco products. Now, the majority of current or former adult smokers began well before adulthood. This early age of initiation also leads to heavier smoking and greater nicotine dependency. So you can certainly see on the left hand of the slide how young people begin for the majority of people who become smokers into adulthood. And you can see the impact of that younger age on the amount of smoking an individual will do in terms of packs per day. This illustrates, of course, the critical role that prevention can play. Now, while we don't have YRBS data due to the pandemic from 2021 to talk about just yet, we do have information from the Behavioral Risk Factor Survey, BRIFIS, regarding young adults, the young adult survey part of that. And as you can see, since 2017, the data show increases in e-cigarette use in the young adult population. I want people to always understand that we focus so much on youth, but when we think about the developing brain and the impact of addicting substances like nicotine, we talk about youth and young adults, which takes us all the way up to the age of 25. From our 2019 YRBS data, we do know that nicotine dependency has become a major issue among high school vaping youth. About a third of students who currently use electronic vaping products used them daily in the past 30 days, which is 3 times the 9% rate of 2015. This really decreases the likelihood of quitting and increases the risk of using cigarettes in adulthood, which is a concerning increase in exposure to nicotine. Looking a little bit at the pandemic, tobacco use among young adults has essentially returned to pre-pandemic rates. Young adults continue to access and use tobacco in spite of Tobacco 21. You can see in the lower right-hand corner of the slide, this is now a perception of youth who believe it's quite easy if you're underage to buy these electronic products. So often we see this slide play out in real life. The use of cigarettes, and specifically here e-cigarettes, and I would use that as a surrogate for the impact of nicotine, leads to other significant uses, whether it be alcohol, whether it be cannabis, whether it be a report of adverse mental health. I think you can see the dramatic differences in those who use versus do not use these electronic products. Now, many Vermonters who are young begin use with a flavored product, which I don't think is a huge surprise to most people who've been looking at this over the years. We're here today to talk about or explore banning flavors, but the studies clearly show that flavors help draw youth in and get them hooked. And in 2019, 86% of youth and young adults who ever tried an electronic vaping product reported that they first tried a flavored one. There's a little bit more data on the slide, as you can see, than just that fact, but it all points to the impact of early use of flavored products. The big topic of the day is menthol, because of course for combustible cigarettes, that is the flavor one can get. And for the electronic products, that is what we're here to talk about, since many of the previous devices like Juul had already had flavor bans, exclusive, unfortunately, of mint and menthol. So we know that menthol makes starting easier and quitting harder, and it is marketed as such. It numbs the throat. It can hide the harshness of the tobacco smoke. From industry documents, we know a lot about the groups that have been targeted, some of which are listed here: youth, African Americans, LGBTQ+. And we know that in 2019 and 2020, sales of menthol flavored cigarettes made up 37% of cigarette sales in the US, which is the highest proportion since major tobacco companies were first required to report those data. Has the kind of legislation that S18 is proposing worked elsewhere? Well, as of April of last year, over 150 communities in the US have implemented laws prohibiting the sale of menthol and other flavored tobacco products. Some of these have been very long-standing, like Berkeley, California. Others have been newer. In 2019, our sister state of Massachusetts became the first US state to prohibit the sale of menthol and other flavored tobacco products. And we have a little information on that I'll share with you. And then in November of 2022, California followed suit. Obviously, too recent to really have significant data to report. So, as I said, Massachusetts banned flavors in 2019. We did see menthol sales initially spike in New Hampshire following that ban, but within 2 years, sales then returned to pre-ban levels. The rest of the states, including Vermont, did not see, as adjoining states, the impact of the Massachusetts ban. And sales of other flavors were not affected. Now, there's some report from the Griffiths data in Massachusetts that among Black and Hispanic, successful cessation rates are increasing and tobacco use rates are decreasing. There's also interesting data regarding youth smoking and vaping, with rates decreasing over a several-year period from 4.3% to 2.9% for smoking, and from 32% to 17.6% for vaping. Now, let's say that S18 became the law, there's really two groups of individuals we need to be very concerned about. One, of course, are those who may not initiate smoking because flavors are not available and they won't be attracted to them in the same way. But the second group is the one I want to highlight here, because there are those who are then not going to be able to obtain the flavored product and may actually want to quit. And I'm just providing a little information here to show that we have a sort of way to catch them, if you will, that's already in place. I'm sure members of the committee are familiar with 802 quits. There's now a tailored menthol protocol offered in 2021 which has been the second most popular protocol on 802 quits. And there's additional counseling and incentive for each session completed. So that population presumably would be able to be supported should they wish to do so. My last slide is just a little bit of a reference list, if you will. But in conclusion, or in summary, this is still a public health problem. Obviously, the pandemic was not helpful. Being a public health problem, the proposal does seem to follow a public health evidence-based approach. I will make note of the fact the FDA has already pretty much announced their intent, though their timeline may be very different than the timeline that the Senate committee is proposing. But it's already being set in motion, if you will, by the FDA. And of course, there are health equity problems that I've highlighted that could potentially be addressed by such legislation. I'll stop there. Thank you for your attention.
Thank you, sir. If I could ask, if you could take 1 minute to describe for our constituents and those that are viewing the Tobacco 21 initiative, just at a high level view of what it is and what its intent was, please.
Yeah, so at the time, of course, one could buy these products at age 18. That was very important because at high school, even if an 18-year-old had graduated, the higher grade juniors and seniors in high school still had access to people who were in the 18-year age range, often were able to obtain products from them, even if they didn't purchase it themselves in a commercial establishment. Raising the age to 21 obviously helped. The proposed reason for it would be to impact the brain development of kids not quite to the 25-year age, but certainly through 21, which is really, really important. And because once you raise the age to 21, it's much less likely that the juniors and seniors or even middle school students are going to have the same level of contact with the population of younger adults who can purchase these legally because you've put them into a higher age bracket. So this was a very, very important intervention, which now, of course, is more widespread than just Vermont, but it was very important at the time.
Very good. Thanks, sir. Senator Wade and Senator Rulett, questions? And Alex, do we have Dr. Levine's presentation in here?
Yes, we do.
Okay,
It's
very
posted
good.
on the.
Okay, well, thank you very much, Dr. Levine. Appreciate your very insightful presentation. And if we can now move to Ms. Zook. Is your can you do
Can I what?
you're allowed
So it's not letting me.
Oh, great.
I don't know why. That's all.
You should be good to share now.
Okay, okay. So it's in changes. Thanks for inviting me. I'm Tita Zook. I'm the Government Relations Director for the American Heart Association of Vermont. I'm really excited that we also have most of the Senate Education Committee here because this is such a problem in schools. You will hear from Jay Nichols, I think tomorrow about this, and some of the students as well. And we heard the same problem when we were talking about Tobacco 21, just how disruptive e-cigarettes and vaping are. E-cigarettes are kind of uncool term for it now. It's come a long way, unfortunately. But can you see my screen? Okay.
Yes.
The American Heart Association, along with our partners with the Coalition for Tobacco-Free Vermont, support S18. These include such respected public health organizations as the American Cancer Society, the Campaign for Tobacco-Free Kids, the Vermont Medical Society, the American Academy of Pediatrics, the Vermont Academy of Family Physicians, and the American Lung Associations, plus a host of other national organizations. You'll hear from 2 of these organizations today. We support the elimination of all characterizing flavors other than tobacco from all tobacco products. And this is essential to reduce the appeal to youth. Some of this is a little bit duplicative from what Commissioner Levine said. Unfortunately, we have a wonderful prevention commissioner, and he has a lot of great data. But more than 8 in 10 youths who have ever used tobacco products started with flavor products, and nearly 90% of youth who use e-cigarettes report using flavored products. More than a quarter of Vermont high school students now vape. And I want to stress something that Commissioner Levine said. When the tobacco control program started in 2001, the youth smoking rate was 33%. We got that down to 7% with the tobacco program, which is wonderful. But our e-cigarette use of 26% is so very close to what the smoking rate used to be. And we know that youth who vape are 4 times more likely to smoke. So we're really in a bad spot and need to do more. Despite the great efforts we have made in recent years with Tobacco 21, e-cigarette tax, all great things, the flavors are really driving kids to go to these products. And as Commissioner Levine said, these products aren't unharmful. They contain nicotine, which is really dangerous to kids' developing brains. So I wanted to talk a little bit about what the FDA is doing or not doing. I would stress. In 2009, the Tobacco Control Act that was passed federally, it was the same law that eliminated all other flavored cigarettes. Unfortunately, it left menthol on the table. It also, however, gave the FDA the authority to do something about it. No flavored tobacco product contributes more to death and disease than menthol cigarettes. And as you can see on the screen, researchers estimate that between 1990 and 2018, menthol cigarettes were responsible for 10.1 million additional new smokers, 378,000 premature deaths, and nearly 3 million life years lost.
So, if I could, can you go back to the previous slide just for a second? So the 2009 Tobacco Control Act didn't involve e-cigarettes because e-cigarettes at the time didn't exist. So it's 2 completely separate issues.
Yes, it's coming up later. They
Okay.
did take some action on e-cigarettes, but not back then.
Okay.
Sure. So I wanted to bring some of these with me today, but unfortunately we have this weather that we do today, so I didn't. But I wanted to show this picture because when we have a cold or a cough and you're feeling horrible, what do you get to make your throat feel better? So menthol is more than a flavor, and I think you'll hear this from Dr. Gardner later. It's a pharmaceutical agent. It makes your throat feel a whole lot better, it makes it feel cool. And that's why it's so attractive to kids. It suppresses the cough and makes the smoke easier to handle, and it makes it appealing to kids. More than half, 54% of youth ages 12 to 17 who smoke use menthol cigarettes. Not that I'm promoting it, but it's a starter cigarette for sure. If menthol isn't restricted in all tobacco products, consumers who formerly use flavored e-cigarettes will be pushed to other mentholated tobacco products. We've already seen this whack-a-mole game with a lot of products that have been out there. When you eliminate one, kids will go to the next one. You don't want to leave anything on the table. They'll gravitate to the next available flavor. We saw this when youth use of mint and menthol e-cigarettes increased sharply in 2019 after Juul restricted its availability of flavors, and so they left mint and menthol on the table. So you'll see the use was 42% before that happened, and it went up to 63%, almost 64% in 2019 afterwards. As the commissioner said, eliminating the sale of menthol also helps to ensure health equity. We know the tobacco industry has been super aggressive in its marketing to people of color. The result now is 85% of Black adult smokers smoke menthol, higher than any other racial or ethnic group. And our witnesses will go into a lot greater detail about that than me. So jumping back to the FDA, It would be great if this was the law of the nation. Unfortunately, it isn't, and I would encourage, and many others of our witnesses here would encourage this committee to take action now. The amount of kids who have started to vape just in the past couple of years has skyrocketed. It will only get worse without action. So the FDA, as I said earlier, has the authority, was given the authority in 2009 to ban menthol. So it took public comment 2013 and again in 2018. And despite this, and despite its own report, it says right there, menthol cigarettes lead to increased smoking initiation among youth and young adults, greater addiction, and decreased success in quitting smoking. And it didn't do anything. In 2020, it did do something. It did, and this speaks to what Senator Weeks was talking about. It did take some action on e-cigarettes, but it only addressed flavored pod-based e-cigarettes and didn't address menthol. So it left tank e-cigarettes that could be refilled and the flavored products that you can refill it on the market still allowed. And unfortunately, also disposable cigarettes. You'll see a couple of them on the side. So when I mentioned the whack-a-mole game, this is exactly what happened. Kids immediately went and drove to a Puff Bar and these other products that were flavored and disposable. And you'll see them everywhere. Unfortunately, some of our students who are going to testify today couldn't because of the weather, also bad internet, but I think you met with them briefly a couple of weeks ago. They came to visit, had some of the pictures of some of these products. So the FDA has started a new rulemaking on menthol that the commissioner said, which is great. It really is good that they're taking action, but we can't assume that it will be quick. It won't be. It issued proposed rulemaking in April of 2022 to prohibit menthol cigarettes and flavored cigars. And this was after citizen petitions were filed back in 2013 and then again in 2021. And this is just the first step of a lengthy rulemaking process. It could take several years for the FDA to issue regulations, and there's no guarantee that the FDA will ultimately ban these products. Just look at the time frame that's happened already. And the FDA, in this action, committed to issuing a proposed rule, but it's not obligated to issue a final regulation. And one thing that's for certain is the tobacco industry will do everything it can to delay or stop this and will file lawsuits, which will take time. So you heard some of this from the commissioner, but I wanted to stress some of our local neighbors are taking action. Massachusetts did. In 2019, it was kind of a two-step process, but the full ban was effective June 1st of 2020. California did, again, in a two-step process, not because they wanted to, they actually passed a bill in 2020. The tobacco industry filed suit, and it was passed by a statewide referendum last November, took effect in December. So all of this, the residents of the state wanted this, which is wonderful. In New York previously, or what's existing right now, is they eliminated the sale of flavored e-cigarettes. But Governor Hochul included in her budget proposal also eliminating menthol tobacco sales as a priority. As Commissioner Levine stressed, we've had some good news about Massachusetts, who has had this in play already. So, and I have the links in my testimony if you would like to look at the study. The study in BMC Public Health found there were significant decreased sales across all flavor products, which is what we want. We don't want them out there for kids to use. And the data is right there, 99.83% drop in fruit flavored, 99.33 in menthol, 99.28 in all other flavored e-cigarettes, and a drop of 95.36% for menthol cigarettes. I don't have the data, but it was terrific that Commissioner Levine did. It also has reduced the rates of use of these products, which is outstanding. A study of sales data in neighboring states was also conducted by Massachusetts to see if people were really buying less or they were just going to go into another state. And as you'll see, it found that this was negligible. There was no significant difference at all. There was some increased sales. The increases were happening everywhere in all states. And the study concluded that laws prohibiting the sale of flavored tobacco products, including menthol products, reduce access to these products while having no significant impact on cross-border sales in neighboring states where menthol cigarettes are sold. So there is a cost to this, and what I would like to stress is the biggest cost is the cost of not acting, as we've seen already. We have 26% of our high school students who are currently vaping. Daily use by the students has tripled in 4 years. The increase from $348 million that we used to spend annually treating tobacco-caused diseases has also increased. It's $404 million every year on tobacco-caused diseases. Now, that's not just e-cigarettes, that's all tobacco-caused diseases. And really, I think the last one is significantly important, the impact on youth and schools in Vermont, and you'll hear about this. Bathrooms are war zones now. Principals are on guard outside of bathrooms. We've heard principals who put their desks now in front of the bathrooms because what is happening in there with the e-cigarettes. Students are anxious and disruptive in class. Athletes are being compromised. There are addicted kids who want to quit, but they're struggling. They never thought this was an addictive product. It was just a cool thing to use. And as I mentioned earlier, youth who vape are 4 times more likely to smoke, so we have greater danger down the road. And young students, as we heard from the students from Leland and Gray, are scared to go to the bathroom where the big kids are who are vaping. So it's a real concern. Lastly, I would like to say that addiction isn't a choice. We are not taking away a choice if we decide to move ahead with this action. We still are leaving flavored cigarettes and e-cigarettes on the table that are flavored like tobacco. We are only taking away the things that are attractive to kids. Menthol and gummy bears, unicorn puke is actual flavor. But more importantly, 95% of the people making the choice as adults to smoke or vape actually got addicted to the product when they were minors. We generally protect kids from choices they aren't ready for, and flavored tobacco should be treated the same way. Once you're addicted, it's hardly a choice at all, especially troubling if the decision to become addicted was made as a teen. With the harm of inaction and costly impact on the state outweighing the desire to provide for personal choice, lawmakers have acted previously on other laws, seatbelt requirements, prohibitions on cell phones while driving, etc. And it makes sense to do so with this. Thanks very much.
Okay, very good. Senator Williams. So I have a few questions. So just for clarification, e-cigarettes, e-vaping products are currently illegal for purchase by those 21 and under.
Correct.
Okay. In Vermont.
Yes.
Second question, Juul restriction, was that a voluntary action on their part, or what prompted that?
Others could probably speak to this better. They got a lot of heat because really they were the company that was getting a lot of kids addicted to vaping products. So they were restricted the flavored products voluntarily. I believe there was, Jennifer maybe able to answer this. I'm not sure.
Jennifer Kirby, legislative counsel. I think it was the type of product that Juul had that fell within the products.
So the first FDA that I mentioned is restriction 2020. That product fell within there, but they voluntarily removed the flavor before that happened.
Okay, good. I'm curious if you have any insight on why the FDA is reluctant to ban flavored tobacco to this point. It seemed like there was a history. If there's any background.
Yeah, if you'll hear some of this from our witnesses, that there's a lot of pressure from truly is a lot of pressure from the tobacco industry on the FDA not to act, and on the federal government, and I imagine on the state government as well. One figure to keep in mind about the kind of money that flows to impact this process by the industry, it spends $15 million on marketing of its products just in Vermont. That's not even government, that's just to market its product. So I would say that is the reason, especially with menthol. Menthol makes up 1/3 of the cigarette market. And so if you get rid of menthol, as I mentioned earlier, that's the starter product. So it's a big hit to the industry because it ensures lifelong customers. If you can get them hooked on menthol, that's, you can have a deeper smoke and get addicted earlier. It kind of guarantees a customer.
Okay. Then my last question, you mentioned the increase of use of high school students vaping. I'm wondering if since the pandemic is ending, if this is beginning to trail off, or if it's still showing a increase of use.
I think the answer is we'll find out maybe next month.
Okay.
So the youth risk behavior survey and some of the statistics Commissioner Levine was referring to came from that. But that's older data, it's done every 2 years. And so we're waiting for the 2021 data, which is exactly what you're talking about, Senator Weeks, would show that. And it's been delayed. And I think the target date from the health department for release is March.
Okay, good. Thank you very much. Very, very helpful. And is your presentation with? Yeah. Okay, thank you. Okay, so next up, Mr. Jefferson, if you could state your name and your organization. And
Yes.
it's yours.
Thank you so much. I'm Delmonte Jefferson. I'm the Executive Director of the Center for Black Health and Equity. I work very closely with Dr. Phil Gardner here with the African American Tobacco Control Leadership Council. And so, Dr. Phil, I am going to steal some of your thunder as I answer. I want to go back and answer at least a couple of questions that were asked. One of the questions that was asked earlier talked about why didn't the FDA ban menthol earlier? Why didn't that happen back in 2009? And Tina, you did a great answer. That was a great answer. This is $1 billion industry that we're talking about. There is money out the gazanes that we're talking about. That's what they're dealing with here. And so one of the primary reasons the FDA that represents both the public's health, but they also represent the tobacco industry. Now, it just so happens that the tobacco industry has this deadly product that kills 1 of 3 people that uses it, but the FDA is still representing them. And so they aren't trying to put the tobacco industry out of business. And the tobacco industry knows the tobacco documents show that if you ban menthol, which, by the way, is in every single tobacco product, is at smaller levels, it's not a characterizing flavor in all those products, but menthol is in every single tobacco product. Just because of what Tina and Dr. Levine said earlier, it makes it go down easier. It makes it easier for you to smoke and consume tobacco products with the menthol in it. And so they didn't want menthol banned. And in 2009, when the negotiations were happening, unfortunately, some of our own partners, our advocates, they coincided with the tobacco industry because the tobacco industry said that they would walk away from that deal. They would have walked away from the Tobacco Control Act if it included menthol. They said menthol has to be removed, otherwise there's no deal. And so some of our partners at that time, they wanted the deal so bad, and it was a good deal, and they wanted it so bad that they said, yes, we'll go ahead and exclude menthol. And so that's how come menthol was excluded back in 2009. Now, here's another part of the thunder that I'm going to steal from Dr. Phil, and I got to do this. Because, we talked about how the FDA set in motion this proposal to ban mentholated tobacco products, this rule that came out, and they've got a rule now, and it was ruled back last year that they're going to ban menthol. That does not happen at all without the lawsuit filed by the gentleman sitting here and his organization, the African American Tobacco Control Leadership Council. They filed suit against the federal government to say, wait a minute, the citizens petition that was out in 2013 that Tina talked about, this is over a decade ago, and you guys haven't moved on it. They haven't done anything with that citizens petition. So they filed a lawsuit. And so because of the lawsuit and because of the other 150 or so local sales restrictions that have been passed across the country, by the way, which our organization and Dr. Phil's organization were in every single one of those, had something to do with every single one of those legislations that were passed. That is the reason why the FDA has finally acted. And so, menthol is a huge, huge deal. It is a lifeline of the tobacco industry. Menthol is a social justice issue. It's the predatory marketing that they've done to African Americans, to LGBT, and to get young people to smoke it. Menthol is the lifeline of the tobacco industry. And so by banning menthol at the FDA level, you really kind of cripple the tobacco industry, even though I'm convinced that they've got a ram in the bush. They already got their next thing that they're going to do. They already know what that is because they're not just going to die away, but we can start to save lives by banning menthol. And that's all I would have to say. And I can take any questions.
Thank you very much. Senator Goulart.
Well, thank you for your words and your testimony today. I learned something. I did not realize that there were small or trace amounts of menthol in all cigarettes. That's new information for me. So I am wondering, when we're talking about a menthol ban, are we talking about the menthol flavored cigarettes? Or are we talking about taking menthol out of all cigarettes, even the trace amounts? And
The FDA is the only organization that can take menthol out and or reduce the levels of menthol. The FDA can do that. At the state level, the only thing that we can do here is ban the sale of mentholated tobacco products. That's our only authority. We can't take menthol out of cigarettes. Only the FDA can do that.
got you, thank you.
Very good. Okay, so along the same lines as Senator Gulick's question, I was also a little surprised that menthol is an additive in essentially non-menthol cigarettes. I'm curious what other additives might be affected if you're aware that there's other, I don't know, there's so many brands that there must be some distinction between one brand and another. And I figure that's somewhere in the chemistry of the additives. Are you aware of any other additives which are routinely introduced?
I'm not aware of other additives. Dr. Phil might be aware, but I am aware of the fact, of course, that menthol in trace amounts is in every, not just cigarettes, but every tobacco products and snuff and all that is in all tobacco products. And I'm not aware of any other additives because the two additives, the two things in cigarettes, and one of them is not an additive, it's part of the ingredient. It's the nicotine and then the menthol. Those are the two destructive things that we've got in these tobacco products. The nicotine that keep you smoking, all right, and keep you addicted and keep you coming back. And the menthol to initiate it, make it easier for you to start. And so those are the two things that we have to really keep our eyes on and really worry about.
Good. Well, thank you, Mr. Jefferson. Appreciate it. Good briefing. I think it's great that actually all the participants for this morning are able to hear each other's testimony. So we're getting a lot of synergy between the different speakers. I really appreciate that. And do we have Alex, Mr. Jefferson's?
I'm not sure that.
If you have a written testimony, could you forward it to Alex so we can put it into the record?
Absolutely, can do.
Thank you. Okay, so we're going to move on to Dr. Valenti. If I pronounce that correctly or incorrectly, please let me know. And the floor is yours, ma'am.
Okay, thank you. I do have slides, but I'm not able to share them right now.
1 second.
And while we're waiting, I'll just chime in to add to Del Monte's comment that there are many chemicals included in tobacco products, many additives. Cocoa is another one. These products are highly engineered to be palatable. And so menthol is one of the chemicals that we know has pharmacological properties with the anesthetizing effects, but there are many, many chemicals involved in these products.
Okay, so Dr. Valenti, you should be able to share your presentation if desired. There you go.
Great.
Thank you.
Thank you for having me. I'm including my disclosures here. My name is Andrea Valenti. I am a scientific expert on menthol and menthol cigarettes and flavored tobacco products. I am the Deputy Director of the Rutgers Center for Tobacco Studies and a tenured associate professor in the Rutgers School of Public Health. I'm also an adjunct faculty member in the Departments of Psychological Sciences and Psychiatry at the University of Vermont and co-director of the Surveillance and Evaluation Core of the UVM Center on Rural Addiction. I'm a Vermonter. My family has been here for generations. I'm committed to public health in this state, and I'm a parent of children who will be affected by this policy, as my whole family will. I'm going to focus a bit on data that I've collected in Vermont young people related to flavored tobacco use, as presented also by Dr. Levine. Again, highlight the data we have from existing policy evaluations demonstrating the public health benefit of these types of menthol cigarette and flavored tobacco bans. And then I'm also going to highlight some of the recent actions taken by tobacco companies to maintain their profits from flavored tobacco, particularly menthol cigarettes. So I lead the PACE Vermont study, which is called the Policy and Communication Evaluation Study in partnership with the Department of Health. And since 2019, we've collected 9 waves of data in young Vermonters aged 12 to 25 that we've tracked very closely with policy changes in the state, and specifically the way that tobacco and substance use has changed over time. Going back to an earlier question on Tobacco 21, you can see it on my slide here. We did have data immediately before and after Tobacco 21. And interestingly, we did see a reduction in access to products, perceived access to tobacco products immediately following that ban. As Dr. Levine mentioned, we see high prevalence of flavored tobacco use in Vermont young people, ranging from 30 to 50% for young people using combusted tobacco products, over 80% in our electronic vapor product users. Fruit, menthol, and mint are the most common flavors used by Vermonters, young Vermonters who are vaping. And as noted previously, over half of young people aged 12 to 20 who cannot legally purchase tobacco products in our state believe that flavored tobacco products are easier to use than non-flavored products. This is really consistent with evidence that we've collected over decades documenting that menthol cigarettes and flavored tobacco products facilitate youth initiation. But another thing I want to highlight here is that they also facilitate progression to regular use. So not only are you getting young people trying these products, but the flavors and menthol in the products help them move to become regular tobacco users, which is what we're concerned about in terms of the longer term health harms of product use. Menthol cigarettes also impede adult smoking cessation. And many studies that have been conducted have highlighted that banning these products would reduce the number of tobacco users and thereby benefit public health. As others have mentioned, there are many flavors of flavor bans around the country. And so the policy evaluations that we have do address many different types of policies, but we see consistent evidence that these policy evaluations show reduced use in youth and young adults when there's a flavor tobacco ban. Where we see menthol cigarette bans enacted, there is consistent, robust evidence of increasing cessation, particularly in adults who use menthol cigarettes. And importantly, we don't see evidence of illicit market activity. So either illicit tobacco seizures or purchases as a result of these policies being enacted. Tobacco remains an epidemic in our country, over 400,000, nearly 500,000 deaths per year. Cigarettes have only become more lethal over time. These are highly, highly engineered products designed to facilitate initiation and continued use. And quitting tobacco benefits people at any age. Menthol choice, flavored choice is not a freedom. More than half of adults who smoke cigarettes want to quit. Fewer than 1 in 10 succeed in quitting. And of particular importance here with relationship to S18, people who smoke menthol cigarettes are more likely to try to quit and less likely to succeed in quitting than people who smoke non-menthol cigarettes. This is an important health equity issue because we see that we have even lower cessation success for non-white people who smoke menthol cigarettes. And Vermont is leading the way in helping people to quit menthol tobacco products. We are the first state to have a quit line incentive program that increases access and adherence with evidence-based treatment to help people quit. So now is really a time to put this policy in place because we have the supports needed. As many others have mentioned, menthol market share has only grown substantially over the past 20 years. Menthol cigarettes now comprise nearly 40% of cigarette profits for tobacco companies, which is driving some aggressive tactics to either prevent or stall the flavored tobacco policies proposed across our country. These are a couple of investigative journalist pieces that came out in the past year about tobacco company tactics to try to stall or prevent these bans, including stoking fear about potential policing action among Black smokers and use of lobbyists in the Black community to try to argue against these public health policies. Additionally, in following California's recent flavor policy, we have seen new products being introduced to the market. So new Camel and Newport varieties marketed by R.J. Reynolds with as fresh or crisp with bold, lasting flavor. These products have been shown to contain a synthetic cooling agent in place of menthol, known as WS3, and this additive has been banned in other countries at this time. So a few policy considerations for our state. We want to make sure that the flavored tobacco ban does not apply to FDA-approved cessation medications like nicotine replacement therapy, that we want to make sure those products are accessible to people to support smoking and tobacco cessation. There may be an opportunity to specify synthetic coolants in Vermont's flavored tobacco ban. That's learning really in real time from what's happening in California. And just want to also highlight that there is ongoing research on flavors and tobacco products at UVM. So whether there's possibility for a research exemption to allow for continuation of scientific research on flavored tobacco to inform and evaluate future policy efforts. I also want to highlight from our PACE Vermont study that we do have widespread policy support for a flavored tobacco ban among our adolescents. And you can see here that over a 6-month period, that support has only increased. And I want to thank you for having me this morning and happy to answer any questions.
Senator Good.
No questions.
Dr. Valenti, could you go back? I'm sorry, can you share again, go back to your second to last slide? Thank you. That one right there. So just curious if there was a study done about adults who favored the ban of flavored tobaccos. Is there any data? We're focusing primarily on youth. Just curious if there were adult studies that have data related to them.
There are national adult studies on this, and those have also highlighted support for menthol cigarette bans specifically. And interestingly, in those studies, we see actually higher support for menthol cigarette bans among Black Americans.
Okay, very good. And I do appreciate your recommendations on the policy additions. Those were quite insightful, so thank you for that. And I have a question for you, which is completely unrelated to the topic, but it's somewhat similar because you're a Vermont researcher. And the cannabis industry is such a new industry in this state and other states. I'm just curious if there are additives introduced to those products, or if this is, if that's not the case.
Yeah, so that's an interesting question. And I think there have to be some more lab studies done on some of these products. And it's not the same sort of manufacturing chain as the tobacco products. Vermont specifically restricts the sale of flavored cannabis products, which is an interesting aspect of Vermont's policy. But I imagine, I don't know how those products are regulated, but I think, there's certainly the Cannabis Control Board could certainly weigh in on that.
Okay, well, thank you very much. Good presentation. Thank you for your time. Going to move on to Mr. Gardiner.
Good morning, and thank you. Well, thank you for having me. I'm Dr. Philip Gardner. I'm one of the co-chairs of the African American Tobacco Control Leadership Council. We sent you a letter earlier this week. I believe I mailed it on President's Day. You should have it there in front of you. The punchline is we strongly encourage you to remove menthol and all flavored tobacco products from the market in Vermont. I can't say this strongly enough. Our organization has been in the forefront of this fight for the last over 20 years. It was interesting yesterday, someone pointed out, we had the first National Menthol Conference in the United States was held in 2003. I was one of the key sponsors of it. At the time, I worked at the University of California, Office of the President, Tobacco-Related Disease Research Program. And increasingly, as the research came in, we began to find out that menthol was something that was not to be played with. Can I share my screen? I'm gonna just do a few slides. I think you've heard host disabled participants sharing, okay.
You should be, you should be able to share.
You should be good now.
You should have control access now.
Can you see my slide?
Yes, thank you.
Okay. So I'm gonna just do, I know a number of people on the call and they know me and I could go on forever about menthol. But what I want to do, and I decided it might be to our benefit, is to do a little deeper dive into actually what we're talking about when we're talking about menthol. Let me just clarify a few things before we get started. I think it's pointed out that somewhere in the neighborhood of a third to actually getting closer to 37% of all tobacco products in the United States are mentholated products. The punchline that Del Monte mentioned in 2009, it's estimated that the tobacco industry is somewhere in the neighborhood of a $220 billion industry. Now, if you take a third of that, we're talking $73 billion what menthol brings to the market. There was no way they were going to get rid of it in 2009. And as pointed out, it took us suing them to even bring it onto the agenda. I think other people have pointed out that, and I've done in my letter to you, that we can't wait on the FDA. Even though they say they're going to make a rule this August, history shows that every time they say they're going to do something, unfortunately, they have not done it. So I would encourage Vermont to go ahead with what they're planning. So I would argue that the ultimate candy flavoring is menthol, and it helps the poison to go down easier. As you can see from the slide, menthol is the chief constituent of peppermint oil. It masks the harsh taste of smoking. It's an anesthetic by definition. As it's pointed out, it has cooling sensation. It activates taste buds, cold receptors, increases throat grab. It mimics bronchial dilation. We have a great study that showed that when you use menthol, it allows for deeper inhalation. You feel like you can take in more, so you pull in more. Even though the bronchia isn't expanding, it's just that it numbs, it blocks the actual pain sensation, allowing you to draw in more nicotine and more toxins. The easier it is to inhale, the more nicotine you take in, the more addicted you become. Look at it this way, menthol inhibits nicotine metabolism. When you smoke a menthol cigarette, it gets into your liver and it becomes what we call cotinine. And menthol inhibits its actual metabolism, meaning it stays in your system longer. We have data that shows that, okay? Deeper inhalation stays in the system longer. Independent sensory activation of neurotransmitters. This is a big word to say. Menthol increases more nicotine receptors in the brain, meaning that it makes you want to smoke even more, okay? We actually have data, we actually funded, where I worked at, we funded a study that actually showed that it produces more nicotine receptors in the brain. It increases salivary flow and transbuccal drug absorption, another number of big words that essentially mean that if you chew tobacco that has menthol in it, it crosses the gum barrier much more efficiently. Greater cell permeability. This is probably the real take-home message. If there's menthol in the cigarette smoke that you're smoking, it will penetrate the cell wall much more effectively than if there's not menthol in it. Or said another way, the more menthol in, the more effective it is in cell permeability. Because as we've already been pointed out, we know that menthol is in all cigarettes and has been for some time. I wonder if I have that slide in here. Yeah, no, this is the slide. Everybody has mentioned this. This is a slide from 1993. As a scientist, I was able, and I didn't attend directly, but soon thereafter. This is a slide from the tobacco industry. This is their slide showing that in regular cigarettes, menthol cigarettes, pipe tobacco, chewing tobacco, there's some menthol in it, period. Wish I were in charge of, we should remove all tobacco, we should remove all menthol and all these other additives. Someone brought up, and thanks, Dr. Valente for bringing up, and someone else brought up the cocoa thing. At one point, the tobacco industry was the second largest importer of chocolate and cocoa in the United States. Why? Because they put it in every cigarette. The second largest importer of chocolate is the tobacco industry. Again, this is a slide from the tobacco industry. Here's something that people don't really understand or not understood. Melanin and nicotine. Melanin is the substance that gives color to your skin. Nicotine is stored in tissues that contain melanin. The darker your skin means the more nicotine is stored in your body. Greater cell permeability, stays in your body longer, stored in certain parts of your body. Are you getting the picture of what menthol is doing? It's already been pointed out, menthol is harder to quit. It's interesting that people who smoke menthol try to quit more often, as this slide shows, but are less likely to accomplish it. What we like to say in smoking cessation, or say it said on the street, is that you're trying to not only get off nicotine, you're trying to get off menthol too. Predation, people have already talked about this. I think what's important about this slide and why I'm sharing this with you, this is a slide that was brought to us by LaTanisha Wright. She worked at the tobacco industry and was so, for lack of a better term, pissed off about the targeting of poor and colored and Black folks. She brought information out and shared with the tobacco control movement. The punchline is these terms, focus communities and non-focus communities, are terms used by the tobacco industry. This is their slide, just like the other one was their slide. In focus communities, inner city, colored, poor, and Black, things are less expensive and easier to buy. In non-focus communities, upscale, suburban, rural, and white, things are more expensive. And of course, menthol cigarettes are cheaper in these communities. I'm going to give you one side on this. This is a great study by Lisa Henriksen at Stanford University showing that as the percentage of African-American students increased, proportion of menthol ads increased. So in communities, whether it's in the LGBTQ community or in the Latino community or in the African-American community, you're going to find increased advertisement as the advertisement went up, as the proportion of the students went up, the advertising went up. I'm going to do one other thing here. This is in Massachusetts, and this was done in 2010. And the punchline here is that in poor communities like Dorchester, compared to upscale communities like Brookline, there are more ads for menthol cigarettes. The ads are larger for menthol cigarettes, for all cigarettes. And I guess the menthol ads are significantly off the chart different. And I guess what is most disturbing is that the average price of a cigarette in poor communities and in African-American communities are cheaper. They actually are cheaper. Now, I think I'm going to we've already been, yeah, I'm not going to go through this. I'm going to stop sharing my screen. And I'm going to I want to return. I was in a part of a conference yesterday, and when I sent you the material, I included a link. We had a discussion yesterday on these the new menthol products, and this will happen in Vermont. It's happening in Massachusetts. They did it in Canada, and they're flooding the California market with these new menthol products, calling them non-menthol products. That as soon as the law is passed, they will come out with new, what we're talking about, these WS3 synthetic cooling agents, and claim that they're not flavors. But let's be clear that they are flavors, and you will be confronting this. So I just want to applaud Dr. Valenti for saying we should include in the legislation that you're considering, not only what is known generally, but what we're beginning to know now about these new products. Lastly, we can't wait on the FDA. I would like to suggest that even though they are saying they're going to get this done in August of this year, my group, the African American Tobacco Control Leadership Council, is prepared to re-litigate and re-sue them. Be clear, as Del Monte pointed out, the reason that we're even where we are today is because we sued them. Because after we've been all over the country, we fight for all these things, and they would do nothing. We finally took them to court, and they finally moved forward on it. We dropped the lawsuit after they moved forward, because that's what we wanted them to do, was move forward. But if it comes August and they haven't done anything, we're going to sue them again. So I think it's really in the state's interest. It's in Vermont's public health interest for you to move forward on that. Again, I sent you our correspondence. Please take a look at it. I'll stop there. And if you have any questions, I'd be happy to answer.
Okay, thank you, Dr. Gardner. Thank you very much. Appreciate it. Very insightful. We're going to move on to Dr. Henderson. You have the floors.
All right. I'm going to share my screen once the screen sharing is allowed. In the interim, can you hear me all right?
Yeah, it's fine. Thank you.
And you should have screen sharing now.
All right. Thank you very much. So I'm a neuroscientist, and so what I'm going to do is, you've got a lot of information about, what has been shown about usage statistic, or cessation. I'm going to provide you what I've seen from a neuroscience perspective. So let's see. All right, here we go. So I'll highlight some of my disclosures just specifically to say that, so I'm funded by the NIH, but pretty much my whole independent career, my funding has all focused on flavors and their impact on nicotine addiction related behavior. So whether it's menthol, green apple, or just flavors in general. And right now we're focusing specifically on the adolescent populations, what's happening with the developing brain. So since I'm talking about neuroscience, first I'm going to give you a very brief overview of what we know about nicotine in the brain. So nicotine alters dopamine signaling. That's something that's consistent with all drugs of abuse, whether it's methamphetamine, cocaine, opioids. Nicotine will alter dopamine signaling essentially by binding to nicotinic receptors. They get their name because nicotine binds to the receptor. But what happens is that over time, these receptors will provide an enhancement in the dopamine signaling. And this goes to what Dr. Gardner was talking about earlier, that nicotine can increase the number of these receptors. We call that upregulation. So this leads to not just the euphoria or the feel-good sensation, despite the fact that nicotine and tobacco products is typically harsh initially. It's enough of the feel-good sensation that facilitates going back to these products. So when Dr. Gardner was mentioning upregulation, this is exactly what it is. This is a human brain imaging. So this is a fMRI showing a brain from the top called transverse section, and then from the side that's called a sagittal section, and then also from the front. And if you look at the colors, what you see is this is a non-smoker control brain, and this is a smoker or a brain of a individual that is tobacco dependent. You can see based upon the color scale, there's more colors, and that's because they're using a tracer that can bind to these receptors. And basically, the brighter the color, the more of these receptors. And this is part of the biological basis of how nicotine changes the brain and then changes behavior. So we're talking about menthol. We're going to talk about some other flavors here. And here's something that you've already heard before. You know, it's a third of the market. Huge proportion of African Americans use these products, and these individuals are less likely to quit. So when we think about just what's happening with the receptors themselves, and Dr. Gardner also alluded to this. So this is a study by Arthur Brody. He was at UCLA, now he's at UCSD, and he's examined the brains of smokers using that same technology I showed in the slide before, that when you compare a non-smoker to a smoker, you get an increase in the number of these nicotinic receptors. But the menthol smokers have a greater degree of their increase in these receptors. And so this is another part of the biological basis of how menthol can have an enhanced addiction risk versus a unflavored cigarette, because there's more of these receptors, nicotine can bind more, and then it can promote more changes in your behavior. So one of the things I typically do is, so I do the things that you can't typically do in a human brain. So I use a rodent model, and one of these things is called electrophysiology. So these brain cells that trigger dopamine release, you can connect to them directly with electrodes, and you can study their function. And so what I've seen in my own studies is that when you compare a control treatment to a nicotine treatment to a nicotine plus menthol treatment, the actual excitability, which governs dopamine release, is enhanced when you combine nicotine with menthol. So this is one indication that menthol helps nicotine do its job better when it comes to changing the brain and then changing behavior. So this is the function of the cells. And so I've mentioned that dopamine release is important. So this is just another data presentation that we can measure dopamine release in a mouse model. And when we do these same comparisons of a control condition to a nicotine condition to one that has nicotine plus menthol, the amount of dopamine that is released in the brain areas important for addiction is enhanced tremendously. So one of the things that I've been funded to do is develop a model that is consistent with vaping. And so what that is essentially I've developed a system where I can train mice to vape. And this is what it looks like. So mice are in a chamber. They have different, what we call operant controllers. And so we teach them that they have to press one button and not the other if they want to get a delivery of nicotine. And what we can do is we can take actual devices that individuals use. So this is a tank that you can get from any store. We actually have an adapter that if you want to take a Juul and attach it to it, and then the mouse will take puffs from a Juul, that they can do that. And we train them over time to work increasingly harder to get nicotine. So these, shorthand designations of FR1, FR3, and PR just means that they press one time to get a delivery of nicotine. They press 3 times for a delivery of nicotine. And once they get to this point, every time they get a nicotine delivery, their workload increases. So it goes 1, 3, 5, 7, etc., to the point where if they want one nicotine puff, they have to press the device 20 times in a row just to get a single puff. And so what we've shown is that we can look at nicotine and then nicotine combined with flavors. And what happens is over the sessions where they're learning how to get nicotine, if you give them just nicotine, they have what we would call a modest effect. But if you combine nicotine with the flavor, the rate at which they learn the behavior and then increase their intake of nicotine increases significantly. So here's nicotine in the salmon colored circles. This is nicotine plus green apple, and this is nicotine plus menthol. So the biggest effect we've seen is nicotine plus menthol. So another piece of evidence showing that menthol will help nicotine do its job. And one of the important things is that if you give menthol by itself, the mice won't self-administer it. So essentially menthol enhances nicotine. They have to be together. So this is just a summation of the data. So if you want to do statistics, this is just showing that, nicotine gives an essential value, we'll just say it, of 10. Green apple combined with nicotine doubles the value. Menthol combined with nicotine is slightly above double, almost triple the value. What we saw that was interesting is that menthol, we've kind of characterized as enhancing nicotine, not doing anything by itself, but the green apple flavors, the mice will self-administer that. So green apple flavors may promote addiction by themselves. And that's basically what our lab works on now. So this is where I'm going to talk about what's happening specifically about the cells in the brain and just green apple flavors. I know that a lot of the discussion is focused on menthol. There's a lot of other chemicals in different products, especially vaping. If you think about the combinations of flavor chemicals in vaping products, there's about 10,000 combinations. And so we've started looking at some of these other chemicals to see how they impact the brain. So the way that we do that is, first I have to remind people that the brain is chemical and electrical. There's ways that we can study that as in our field of neuroscience. And the way that we do that is using something called electrophysiology. And this is just to show that you can take live brain tissue, either from rodents, and if you are connected with a neurosurgeon, so many times if they do a procedure where they have to actually get to a certain region of the brain, they actually remove brain tissue. You can get this, and then you can put it onto one of these devices. You can image the neurons that are in the cell, and while they're live, you can connect to them and study their function. So in this study, we're using a mouse model that is consistent with our vapor setup. And this is just to show that if we give a mouse just green apple, so we're not giving them nicotine, we're not giving them menthol, we're just giving them green apple. So this is showing that these dopamine cells, so here's a control brain cell, here's something with green apple, they're firing much faster. And so this would indicate that you would actually have more dopamine release. This may be, addiction or contribute to addiction related behavior. And this is just the summation of the data that if you have a control sample versus the sample that got green apple, it's about a 5-fold increase in their activity. And so we can do similar experiments as I've shown before that you can measure dopamine release in these samples. And I'll just cut to the summary of the data that here's a control sample, here's a sample where you got green apple. So it's about a 10-fold increase in the amount of dopamine. So this is just to show that while we've talked about nicotine and menthol, there's other additives that are in vaping products that can contribute to changes in neurochemistry. And this is definitely going to contribute to behavior. So that's all I wanted to show, because I know that this was a lot of neuroscience, and even for people in the field, it can be hard to digest. So I hope what I'm trying to drive home here is that menthol enhances addiction-related behavior, does this by altering neurons, altering dopamine release. So the green apple flavors, they can enhance this behavior as well, but they're unique so far because the menthol hasn't shown much impact by itself, but green apple by itself can change neurons and change behavior. This is basically due to cells that are responsible for dopamine release. Their excitability is changed, that is triggering changes in the release. And so really, if we kind of think about the reward pathways of the brain, so these dopamine cells that control dopamine release, that give you the euphoric sensation, they're enhanced by nicotine, they're enhanced by menthol, and then green apple by itself really enhances this pathway, and this is what's going to be affecting behavior. So I'll stop there, and if you have any questions, then I'll be happy to answer them.
Okay, very good. Comments.
No questions.
And we have Dr. Henderson's presentation.
Yes, I believe that we do.
Okay, thank you very much, sir. Appreciate it. No questions. Looking to see if we have a final speaker for the first part of the morning.
Eric?
Oh, very good. So Ms. Segrist?
Yes.
Is it? If you would join us. And if you could, when you're seated, state your name, your organization, and
Good morning. For the record, I am Erin Segrist, president of the Vermont Retail and Grocers Association, and have the pleasure of being here yet this year. So nice to see you all. Thank you for having me in this morning. So Vermont Retail and Grocers Association, VRGA, we represent over 750 members across the state. Our membership includes many business types and models, so general stores, grocery stores, convenience stores, distributors, the clothing store down the street. And so we are here to talk about the financial impact of the legislation that S18 would have on the retail landscape here in Vermont. I also do want to share a little bit about member feedback. Members across the state have shared with me that banning such products would eliminate up to between 4 and 10 positions in various stores, depending on the size. In a state where we already have a staffing shortage, the bill only exacerbates this issue, placing additional strain on the unemployment trust fund, social services, and also we anticipate most likely exacerbating addiction due to a lack of job and finding purpose. We're not here to judge those that are addicted. We're not here to support or encourage smoking. Again, I'm here only to talk about the financial impact. I have not, and I'll apologize, I have not seen a fiscal note on the impact of this bill, but I did do some deep diving into the Department of Taxes and did notice that we're looking at a little over $75 million in revenue from tobacco sales in 2023. I don't know if that is correct, but I would encourage the committee to hear from Joint Fiscal on the impact of our revenues. $75 million seems to be a large hole that would need to be filled in order to, if you were going to ban these products. Again, polling my members returned a broad impact on the size, depending on the size of the retailer. Some retailers reported anywhere from $40,000 to $90,000 in losses. Those on the Massachusetts border reported higher, on the higher end of that poll. One example, we have a Vermont-based convenience store that has shared that they have supported cancer research and additional nonprofits for the past 15 years to the tune of $250,000 to $350,000 a year. Such bans on the sale of products which would reduce their sales and revenue significantly would ultimately eliminate that type of benefit to the community, the nonprofit community here in Vermont. Local Redemption Center here in Washington County has reported that they would lose about $50,000. And that does include ancillary purchases that customers make when they do come in to purchase tobacco. Again, it's not our place to judge, but we do find it disingenuous in banning such products. I know that you heard from one previous witness that flavored cannabis is banned, but in doing some research, I'm sure that if you looked at any website from a cannabis retailer in Vermont, you would find really exciting names such as cookies and cream, strawberry gummies, chocolate peanut butter cups, Skittles, Slurricane. So it doesn't sound like flavored cannabis has been banned. The legislature has legalized cannabis, and here we are trying to ban flavored tobacco. Just seems a little counterintuitive. Again, I would love to see a fiscal note. I think that would speak volumes. And then one last piece that I do want to just reiterate. I've been testifying on this proposal for about 5 or 6 years now. So I would also encourage the committee to hear from the Department of Liquor Control. They manage the tobacco compliance tests. They have not updated their website with most recent compliance tests, but in 2018, the overall percentage of licensees who did not sell tobacco to minors was 91.9%. And in 2019, that compliance rate was 92.3%. So I think there's value in understanding that retailers aren't selling to minors. And I think that, you know, if we're going to be spending our time talking about minors smoking or vaping, then we should be using it to address how we can support their mental health and doing outreach and education to eliminate some uptake in schools or in the younger crowd. Happy to take questions.
Quick one. Thank you for giving us another view on all of this. I had heard from a few small businesses. I just wanted to push back on one thing you said, which was that there will be some positions eliminated if this ban were to go through. And I guess my point is simply that we are in a workforce shortage. So it does seem as though if folks were to lose their jobs, they would be able to find work elsewhere, just given the vast number of positions that are available. So I don't really see that as necessarily a problem that will be caused by this.
It might not be a problem to people outside of the business, but the business needs employees to operate. The business needs employees to stock the shelves and make sure that products that haven't been banned are on the shelf or customers are serviced. So it is an impact, unfortunately, on the business. I understand where you're.
I've been holding back on this, but I just gotta say it. I was a smoker for 40 years. And I moved to menthol cigarettes because it made it more palatable. I couldn't stand smoking regular filter cigarettes anymore. And it enabled me to continue to smoke. So I get it. I understand everything that has been put out today is interesting, and it's, you know, based in fact and science. I wish I'd never started smoking, but I did. It's an addiction. And you know how I finally quit smoking? I stopped buying them. That was the only way. I tried weeding myself from them. I would give friends of mine a couple bucks so they would give me a cigarette when I needed one. But eventually I just stopped because I stopped buying them. So my point is to ban, you know, why are we gonna ban filtered or menthol or flavored? Why don't we just ban them all? And then you know what? If they had done that with me, I would have gone to New Hampshire. I live on the New York State border. And while I was in New Hampshire, I probably would have stopped and bought a couple bottles of booze and maybe had an accident on the way home. You know, Vermont's not a very big state. And I advocate for this bill. I really do, but it's, you know, we're creating, by passing this, we're putting people on the road to go buy cigarettes from somebody else and impacting the people you represent.
So your question was, why don't we just ban them? I think you just answered that, right? You had to choose to stop smoking.
Exactly.
And that, you're an incredibly strong person to make that decision, right? Outreach and education and providing support will help other people stop smoking. By banning products, that doesn't make people stop. It will exacerbate or help grow the underground market. It will send people out of state.
That's my point.
Right. So banning a product, telling you can no longer smoke or vape doesn't mean that they're going to stop, right? So I think you said it right there.
So I have a question related to your testimony. We'll come back. So I was just curious, the numbers that you quoted in the loss of sales, I'm just curious if these were losses for all flavored tobacco products, or if those numbers related to like all tobacco products?
All flavored tobacco.
All flavored only. Okay.
Yes.
Sure.
Senator Wolf, thank you for saying what you said. A couple thoughts. One is that a lot of the testimony that we got today really speaks to keeping folks from getting addicted to start with, especially young people. And I think that's a really important piece of this legislation. The second one is, you know, I'm finding in this building that we often present sort of these one-off or, you know, personal stories and anecdotes about one person's individual triumph over whatever the issue is. And it's great that you have the strength and the fortitude to be able to quit. That doesn't mean that systemically this is okay. You know, and I do think whatever the issue, we have to look at the system and the structure. And one success story does not solve the problem.
I
So,
agree.
yeah, and
I'm just using that anecdotally so that
Yeah.
people can understand that, you know, we smoked Cools because it was cool.
Yeah.
Right, when I was a young adult. And it was, we didn't understand the science of it. But I'm saying is that if you're gonna cut flavors, eventually it's a generational thing. My grandparents, my father, so all smoked. And it made cigarettes available to me when I was a young man, a young adolescent. And I think it's gonna take a generation to get rid of it all. And we're never gonna get rid of it all. People want to abuse their bodies, they're going to abuse their bodies. So I just want to say that.
Okay, good. Certainly. So appreciate it. So this morning, we've had a good dose of, no pun intended. We've had a good introduction to some science and some data. We're going to take a 10-minute break. We'll come back and we'll continue with the same SA team, same topic, different speakers, and we'll move on. Thank you very much.
Thank you.